The title of our study today is Thyroid Cancer and Associated Factors Among Patients Attending the Nuclear Medicine Center, صنعاء, Yemen. Outline of the study, the introduction, objectives and hypotheses, research methodology, results, and finally conclusion and recommendation. Introduction. Background of the study. Thyroid cancer is a type of cancer that originates in the thyroid gland. This gland is part of the endocrine system, which regulates hormones in the body. Thyroid gland has two types of cells: follicular cells that differentiate thyroid cancer, and parafollicular C cells, where medullary thyroid cancer originates. Thyroid cancer is one of the most common malignant endocrine gland tumors worldwide. Thyroid cancer incidence has increased almost twofold during the last few decades. It's estimated that thyroid cancer prevalence is 1 to 5 in females, ranking 5th most common cancer, and 2% in males, ranking 14th most common cancer. Many factors play a role in pathogenesis, such as gender, age, iodine radiation, hormonal factors, breast cancer, etc. Problem statement. In 2018, thyroid cancer ranked in 9th place of incidence. The global incidence rate for females is 3 times higher than in males, and it represents 1 in 20 female cancer diagnoses. Mortality rates, however, for the disease are very low. They are from 0.4 to 0.5% for males and females. In 2021, an estimated 44,000 cases were diagnosed with thyroid cancer in the US. The largest increase in new cases of thyroid cancer occurred in adolescents aged 15 to 19 years old. Between 1998 and 2012, the frequency of thyroid cancer in Gulf Cooperation Council was approximately 4-fold higher in females than in males, and average age standardized rates also increased. In 2020, the estimated incidence of thyroid cancer in Yemen was 3.45%. The prevalence was 3.69%, and the frequency of thyroid cancer among thyroid nodules was 13.8%. There are no clear data available regarding the incidence, prevalence, and trends of thyroid cancer in Yemen, apart from WHO Globacon estimations and few studies that address the problem. The current study was conducted at the Nuclear Medicine Center at Al-Thawra Modern General Hospital in صنعاء, Yemen, which is the only center specialized in treating and providing radioactive iodine for patients, and is considered the referral center from all hospitals and centers in Yemen. Hopefully, this study, together with the previous studies, can form a baseline for future studies to compare and assess trends and risk factors of thyroid cancer in Yemen. Study design. A descriptive cross-sectional study was conducted to assess the thyroid cancer and associated factors among 1,431 thyroid cancer patients registered at the Nuclear Medicine Center from July 2008 till July 2021. All thyroid population and sample of the study. All thyroid cancer patients registered at the center were enrolled in the study. 304 patients with thyroid cancer were selected to participate in the study. Conclusion and recommendations. The findings of this study suggested that sex, age, exposure to pesticides, consuming seafood, consuming iodized salt, benign thyroid conditions, high-risk occupations, tobacco smoking, and greater height and body mass index were associated with thyroid cancer. However, according to this study, the risk of thyroid cancer was not associated with presence of other cancers, family history, or childhood radiation exposure. The study found that reproductive health factors, menstrual irregularities, number of deliveries, and history of abortion were risk factors for thyroid cancer. However, according to this study, age at menarche, age at menopause, process of achieving menopause, and use of oral contraceptive pills were not risk factors. Recommendations: direct supervision of the Ministry of Public Health and Population on all health sectors to maintain standards. Institute a protocol with more accurate histological criteria and enforce it on all histology labs. Train radiologists and pathologists according to the updated guidelines and renewed criteria. Establish a clear guideline, specially designed and fit for dealing with thyroid cancer patients in Yemen. Provide radioactive iodine for patients, and provide screening tests, surveillance for the patients, especially long-term differentiated thyroid cancer patients. form support groups to help patients cope with any mental emotional stress, raise the awareness of the general population towards thyroid cancer, and encourage routine checkup tests, especially for high-risk groups. Initiate the active surveillance observation without surgery or treatment. Establish a surveillance program to determine the true prevalence of thyroid cancer in Yemen and conduct further epidemiological studies with a higher level of evidence, such as a case-controlled studies or population-based study in Yemen. Thank you.
جامعة الرازي، اختيارك نحو مستقبل أفضل.